Hello, I'm Hubert Fornalik. I'm a gynecological oncologist with Franciscan Physician Network. I decided to be a gynecological oncologist because I realized that dealing with difficult problems, it comes relatively easy for me. And I always found it rewarding when we are able to help patients who are in difficult situations. So that's how it worked out. A gynecologic oncology surgeon is a person who went through two specialties before, meaning went to the residency in OBGYN and then subsequently did additional 3-year or 4-year training in gynecologic oncology. Our practice focuses on women with gynecological cancer, but also on women who have suspected cancer or difficult gynecological conditions that require complex surgeries, like patients with endometriosis, sometimes patients with multiple prior surgeries. As a physician, I'm most passionate about finding what's the patient's goal and trying to satisfy it. Although initially it may seem like everybody kind of wants the same, it's not exactly the case. So you kind of need to dive a little bit deeper and find out what's really important in patient's life, try to figure it out, and then make adjustment and try to make it happen. And that's really the most rewarding part. My philosophy of care is that the patient takes a center place in it, and patient is the driver of everything what we do. So that requires that I figure out what's really important for the patient, and requires me to educate the patients what the options are or what choices are in front of the patient. I chose to practice medicine at Franciscan Health because I think Franciscan has their priorities right. I think the patient is the priority here. You know, at other institutions, academic centers, quite often the research is priority. In private practice, it's a little bit different, just the business is priority. But at Franciscan, we focus primarily on the patient, and you can see that, and I saw it, and that's why I'm here. When I'm not in the office practicing medicine, I will be at the soccer stadium watching kids playing traveling soccer, or traveling somewhere, hiking, maybe sightseeing. These are my favorite things to do. One piece of advice is to advocate for yourself. Unfortunately, you know, healthcare is in crisis everywhere, so it's very important that you take care of your part as much as you can. Research your options, know what your goals are, and be open with your physician about what you would like to achieve.